Good evening, everybody. As Elizabeth says, my name's Mark Collins, and I've been with Mercy Ships for about 4 years now, actually. Let me go ahead and share, because I want to share a little presentation with you. I will assume, unlike you, that we don't know what Mercy Ships is. Mercy Ships is, as far as we're concerned, this is God's mission. We seek to follow the 2,000-year-old model of Jesus, bring hope and healing to the world's forgotten poor. Our mantra really is to bring hope and healing to the least among us, as God said. Why do we do this? Mercy Ships is really all about bringing safe, free surgery to those who cannot get surgery. So this graphic shows the access to surgery all around the world. And we can see the key areas of around sub-Saharan Africa particularly, that really just lack safe surgery. Excuse me, this has actually just put itself above my notes. So every year, nearly 17 million people die, basically because they lack access to surgical care, which is, as you can see, more than all of the common issues put together. I want to, rather than you listen to me drone on, I want to play you a little video that will explain things a little bit better.
Mercy Ships is on a mission to bring hope and healing directly to those who need it most. In many nations in sub-Saharan Africa, access to surgical care is limited, unsafe, or unaffordable. 9 out of 10 people in need of surgery are left without hope. And tragically, every 2 seconds, someone dies because of a surgically treatable disease. Mercy Ships exist to change that narrative by bringing safe, free surgical care and surgical education using the world's largest civilian hospital ships, the Global Mercy and the African Mercy. On board, volunteer professionals from around the world treat conditions like cleft lips and palates, burn contractures, bored legs, obstetric fistulas, cataracts, benign tumors, and more. Meanwhile, Mercy Ships supports partner African nations to strengthen their surgical systems through education and mentorship, expanding their capacity to deliver quality care in the long term. Over the past 45 years and counting, Mercy Ships has performed more than 114,000 life-changing and life-saving surgical procedures, trained more than 53,600 medical professionals, and gifted services and material valued at over $1.8 billion. Now, with the 2-ship fleet currently active in Madagascar and Sierra Leone, Mercy Ships will be able to double the impact and provide life-transforming surgical care to more people than ever before. And it's about so much more than numbers. Each number represents a name, a face, a story, and a new hope for the future. Because as followers of the 2,000-year-old model of Jesus, we believe everyone deserves the opportunity to live a full and healthy life. Through a global community of partners, donors, and volunteers, together we can change the surgical landscape in African nations today and in the future.
So to play you that video, I always tend to think that a video can tell things so much better than I ever can. Perhaps over the next few minutes, I will probably reiterate a lot of that. Oops, no, that wasn't meant to happen. So this gives a little snapshot into just why we focus on where we do in sub-Saharan Africa. We are currently, as the video said, we are currently active in Sierra Leone and in Madagascar. I thought Sierra Leone's probably a good little comparator to New Zealand. In New Zealand, we have 5 million people, roughly, and we have about 850 specialist surgeons, whom I'm guessing most of us have been touched by in some way. This year alone, personally, I've had a cataract my second cataract operation. I know every one of my family has been, some of them quite possibly only alive because we have great access to surgery here. In Sierra Leone, a country of 8 million people, they have 5 surgeons. And those surgeons, not only can they obviously not keep up, but people without the money really can't get access. Yeah, so hopefully that kind of, I guess, gives the idea of why we do what we do. So why do we focus on ships? Over 40% of the world's population, actually I think that's a little bit out of date and it's growing now, it's heading toward 50% of the world's population, live within 100 kilometers of the coast. A ship really means that we can bring state-of-the-art surgical care to these nations. And just to diverge very slightly, we spend about 10 months in any given country. We go away for about 2 months to reprovision and effect maintenance and other things. So we will go into a country for about 10 months and seek to bring this state-of-the-art hospital ship. For the Kiwis among us, sorry Hugh, these ships they're a large ship. The Global Mercy is about twice the size of an inter-islander ferry. It contains 6 surgical theatres. So at any given moment, we tend to be operating on 4 to 5 different specialisms, from cataracts to orthopedic care to facial, maxillofacial work and so on. But the ships mean we have that contained, very hospital environment, contained in the sense that we can control that environment. We can bring this sterile environment there, and we can seek to, well, let's move on. I think we talk about this in a moment, but yeah, we can seek to actually both do the direct surgeries. In doing so, in any given field service, we will call that 10-month period. In any given field service, we can do many thousands of operations. But in that country of 8 million people, that's a small drop in the ocean. What we really actually seek to do is train up and build the local healthcare professionals so that, and we will go back to each country a number of times, with a number of years apart. And we will seek to work with many of those healthcare professionals whilst we don't have a ship there. But our real purpose is to train them up to leave the country better than when we left. So that's a little bit about why, what Mercy Ships is. A bit about why now. Patients. This is a chap called Amadou from Ghana, where we were a number of years ago. As you can see, he himself is a doctor. who was over about 10 years suffering from a facial growth, a benign tumour. He had a heart to help his nation, but as you can imagine, with that thing constantly growing and getting larger, many people did not wish to come and see him. They didn't really understand, and so that's an example of hopefully where we have not just helped one person, but actually helped strengthen the entire nation by providing some healing for Amadou. More patients, such as young children. This young chap here suffering from a very similar thing, and very proudly showing off his scar afterwards. Many young children who suffer from bowed legs, which perhaps don't come across so well there. This is a young girl called Armella. We do more things than just facial tumours, but they are perhaps the more graphical things. Armella, who is actually just being healed this year. Alongside actually, this is after her surgery, I think a volunteer from South Africa. I'm conscious of time, and I wanted to, hopefully, if we've got time, share with you another little video. It perhaps will reiterate a bunch of similar things, but this was produced as we went into Madagascar just earlier this year. Let's put some of the words into some of the Madagascar people.
Yeah, the ship is coming to Tamatave tomorrow. Yeah, it's make us too very happy.
Today we've witnessed the arrival of the Africa Mercy into the port of Toamasina.
Our arrival was so fun. We got to see the flags waving and the greeting. We had people dancing, and just a lot of joy and excitement, recognizing that this is the culmination of a lot of work. A lot of people have been working really hard to make this happen.
The reason we do what we do is because there is such unmet surgical need in these countries, and Madagascar is one of those countries. This is a really unique time because we came in yesterday to a country that we have history, and we've seen God at work in these rooms, in this hospital, that we want to see that continue. And to do that, we actually needed to spend some time upgrading some of our equipment, upgrading some of our facilities to be able to continue to do that into the future.
Because our ships are essentially platforms for doing great work. We do have to make sure that the platform works. That's why we've had to do all these upgrades. But without the people, the platform means nothing.
And unless you get to experience it yourself, it's hard to wrap your mind around what it's like living on a ship in a small community where everybody is focused on the same thing, which is to bring hope and healing to people who need it most.
The ship has inspired me and shaped me in so many ways.
To bring the joy into someone else's life when I've received that joy myself is why I'm here.
You know, when you come with Mercy ships, you get spoiled for the ordinary, and your life will be changed. You will never go back to what you were before. And so I think it's an incredible experience.
Doing that. I'll keep it all brief. So really our job here at Mercy Ships in New Zealand is to make Mercy Ships as God's work, and we simply need to make people aware that they can come and do this and be a part of Mercy Ships in some way. So I guess my plea is, if you know someone who can go and serve, whether they can serve as a cook, an accountant, a housekeeper, or obviously we have a lot of medical people on our ships. Make them aware of mercy ships. We need people all the time. And I will leave you, I'm not disappearing, but in the presentation, Anna Zhong is here to work specifically with churches and all mission partners. She would otherwise, you'd get a much better presentation from Anna, but she is actually serving on the Global Mercy. She's an optometrist by trade. So she's been there for 2 weeks now, screening people for cataract surgeries and other things. So please reach out to Anna or myself or anyone else at Mercy Ships.